From the News 18 studios, COVID, a return to normal. WLFI Lafayette, news from where you live.
Well, welcome back. After a brief pause in its use over blood clotting concerns, a new push is on now for people to get the Johnson & Johnson vaccine. But will hesitancy still be a problem? And what about those blood clot concerns? Dr. Jeremy Adler is Tippecanoe County's public health officer, and he joins us now in the studio to answer those and other questions. Dr. Adler, thanks so much for coming to see us.
Thank you for having me. It's great to be here.
Nicholas Fetchina submitted a question. He wants to know, how do you convince people to get vaccinated?
That's a great question. You know, we have so much excellent data from the vaccine trials and from all the follow-up that's being done after the vaccines have been administered that really show us that these vaccines are safe. We know from the trials that they are effective. So it's really a matter of people getting that messaging and getting their information from good, accurate sources and knowing that these vaccines are safe and effective and that they are really our best path out of this pandemic.
Do you, when you meet with patients, do you actually have those conversations? Do people say to you, I don't think I'm down with getting vaccinated? And how do you respond to that?
Sure. You know, I think the important thing is to meet people where they're at, to find out what their specific concerns are, and then address those concerns in an honest, open way. Some of those answers we don't have yet. Some of them we do because we have a lot of good data from the trials that were done on the vaccines. So, you know, I think it's really a matter of relying on the science and the data and letting that guide our decisions.
You told me before we got underway this afternoon that 22% of Tippecanoe County residents are now fully vaccinated. Herd immunity, though, is somewhere in the 70 to 80% range. Dave Leininger has a question. How are we going to achieve goals such as herd immunity when so many folks are avoiding the vaccination?
That's a great question. You know, we are obviously a ways still from herd immunity, but we are inching our way that direction gradually. It's important to realize that here in Tippecanoe County, 77,000 people have already gotten their first dose of COVID-19 vaccine, and 22,000 are now fully vaccinated. So that's a great achievement, and we just need to keep working on that and getting more people vaccinated to get us closer to that herd immunity number.
I'll ask you again about interactions with individuals in the community. Have you heard people say, I don't want to take the vaccination because of complications? You know, a lot of stories, and we talked to some other people about complications that they had after the second dose. They didn't feel good for 24 hours or so. Is that what's driving some of that hesitancy?
You know, maybe for some people. I think that some people also are worried that there may be some side effects that have not been discovered yet because the vaccines are new. But we should all take comfort in the fact that the FDA and the CDC are monitoring the safety of these vaccines among millions of people who've received them. And they are taking that information into consideration. And I think what happened with the J&J vaccine is a good example of how seriously they are monitoring the safety data. And it really is a testament to the fact that the monitoring system works and that they are looking out for our best interests.
Well, you read Nancy Smith's mind. She submitted a question. How long after receiving the Johnson & Johnson vaccine do you need to monitor for blood clots? And I'll throw in a question too. What does that monitoring even look like?
You know, I don't think there's been an established time frame yet for how long one would need to monitor. But it's important to remember that the number of people who experienced blood clots after the J&J vaccine was incredibly low. You know, only I believe 17 out of nearly 8 million doses given. So it's a very rare problem that's occurred. And I think, you know, the things to look out for would be things like leg pain, difficulty breathing, headaches, abdominal pain. Those are symptoms that you'd want to bring to the attention of your healthcare provider.
Okay, Dr. Jeremy Adler, we're out of time, but I really appreciate you spending time to help educate the community about some of the vaccination challenges and some of the answers. Thank you so much.
Thank you.
All frontline medical workers face life and death challenges every day, especially during the pandemic.
That keeping them away, people away who hope to have a career in healthcare. We'll bring you the answer coming up after a short break.